Hello, this is Dr. Jason McClellan from Hampton Veterinary Hospital, and today I'd like to talk to you about dental care in your dog. So similar with us, is that keeping a healthy, happy, pain-free mouth is very, very important to overall life in general. It's having a nice, great quality of life and how we feel as far as just simply as chewing or living our daily lives. But it's also important and provides longevity and reduces other diseases or problems that can occur in our body. Ideally, we want to keep a happy, healthy smile and keep all our teeth in our mouth for as long as possible, if not our entire lives, and we want that for our pets as well. So when you come in for your once or twice a year wellness exam with your dog, your veterinarian here will definitely do a thorough oral examination and make appropriate recommendations when your pet will need to start regular oral care as a young dog or puppy. It's including regular toothbrushing and or appropriately dental chews, water additives, food additives to help slow down tartar onset. But eventually all tartar happens. We can't stop it from happening. Just like with us, we brush and floss multiple times a day, at least we're supposed to, per our human dentist recommendation, but we still, typically our dentists now want us to go in twice a year to have a dental cleaning. Well, we don't typically, in most situations, recommend twice a year dental cleanings for most of our canine loved ones because it involves general anesthesia, so there's certainly some risk involved, as well as the cost or increased cost compared to what our dental care costs without needing general anesthesia typically. So we don't take this lightly. We screen our patients as far as on examination as well as blood work before considering general anesthesia. But our staff here is trained and understands, and we take great pride in making sure that our pets are doing well during, before, and after general anesthesia. And because of that, we have an excellent track record with safety as far as pets doing well and going home and continuing doing well health-wise when we are anesthetizing our patients for things like dental cleanings. Dental cleanings typically involve being here for a good portion of a day. We place us safely under general anesthesia, clean all the tartar from our teeth and under the gum pockets, do a charting of all our gum pockets, just like our dental hygienist would do, take x-rays or all digital x-rays so it's quick. We can save those images, and then the doctor evaluates our mouth and then our x-rays, and then we determine whether or not anything needs to be done. Hopefully we're doing dental cleanings as recommended in a timely manner so then we're not losing any teeth. But sometimes, as it happens, dental cleanings get delayed for different reasons, and then periodontal disease sets in and gets to the point where it's fissuring under the gum line, loosening the connection between the tooth and the mouth, and eventually some teeth get loose enough where we can't save them, and your dog will benefit from having those teeth extracted. We want to reduce that likelihood as much as possible, but sometimes that's not possible. So the best thing we can do for those pets is to remove those painful teeth that are only going to get worse and fall out anyway. But we're very cautious with pain management with our pets during the process and afterwards too, and super cautious with our anesthesia. But doing dental care and staying up on that, just like with us, can improve how we feel overall, or how our pets feel overall specifically, and then how our pets do in the long term, also reducing risk for things like bacterial infections getting into other areas of the body, especially places like heart valves, just like with us, that can happen with our dogs as well. And so again, we can control those potential diseases by taking care of our oral care when appropriate. Dogs in general, smaller the dog, they tend to develop tartar faster. So if you have a large or a giant breed dog, they might only need 1 or 2 dental cleanings in their whole life to stay up on that dental care and not lose any teeth and keep things healthy. Whereas you had a small or a toy breed dog, starting at 3 or 4 years of age, they might need a cleaning every 12 to 18 months to stay up on things. So your veterinarian here will advise you on the best things to do for your pet in order to keep our mouths and our bodies overall healthy. If you have any questions, as always, feel free to reach out to us by phone, email, or text, or during one of your regularly scheduled appointments with your dogs so we can discuss more with you if you have any further questions or concerns.